I mark the treatment area, focusing on areas with more volume. I will focus on the nasolabial folds and marionette lines. Mark the area considering facial nerves and vessels. Adequate anesthesia is recommended. I usually start with nerve block anesthesia. Then I determine the entry points. Multiple directional approaches can be used. If needed, I may approach from below. Anesthesia is performed before the procedure. It is more comfortable to perform anesthesia before disinfection. I start tumescent injection from the deep layer. If there is resistance, I proceed slowly while working through the resistance. About 20 is injected per side. More solution is used in firm areas. The settings are 40 watts and 50 degrees Celsius. When ready, activate APOLEX Tite with the foot switch. Green indicates standby mode. Blue indicates energy delivery. Red indicates automatic stop. Press the foot switch again to resume. I begin from the deep layer. Resistance gradually decreases during treatment. It usually takes about 3 to 5 minutes. Proceed carefully around nerve areas. Avoid going too deep. Now I move to the tightening phase. I lift the tip upward while treating. The temperature rises up to around 50 degrees, and patients may feel a sensation of warmth. This step creates the lifting effect. I proceed for about 1 minute. You can expect an effect similar to thermage. If needed, melted fat is removed with 18-gauge cannula suction. This helps reduce swelling. The final contour appears more natural. The same procedure is repeated on the other side. 2 minutes of treatment followed by 1 minute of tightening. It is important to proceed slowly. Avoid excessive treatment. If necessary, finish with suction. Mild swelling after the procedure is normal. It usually lasts for 2 to 3 days. Swelling varies depending on tumescent volume. Less volume results in less swelling. For better results, sufficient tumescent is recommended. Choose based on the situation. Hyaluronidase speeds recovery but may increase bruising. Adjust the method depending on the patient. Taping helps manage swelling. Remove it the next day. This concludes today's procedure. Thank you.